one of the things that we're really trying to highlight during this series is, what should happen at a point in a youth's life when some of those events occur, and what happens if, in fact, during those situations they have contact with our criminal justice system. What are the kind of consequences that should ensue? More than 2 million youth and young adults come into contact with the juvenile justice system each year. And up to 70% of these young people have been diagnosed with at least one mental health disorder.
Most of these kids don't belong in the juvenile justice system. Okay, most of them are experiencing behavioral health problems. And when you get out there in the field and you talk to the judges and you talk to law enforcement, and particularly when you talk to family members, for the most part, the understanding is most of these kids have not done something seriously wrong. And again, there's some data up there that supports that. It's that we don't know what else to do with them. And so when you talk to family members who say, I literally have contacted 80 different agencies because my kid is acting funny, there's clearly something wrong, and he needs some kind of help, and I can't get any help, what do I do? The piece that we're still doing a terrible job on is making sure that the systems are working together. We still don't have mental health working in most cases. All three of those diversion programs that I mentioned, a key piece of making them work was getting the local mental health provider on board, so that when the law enforcement official says, this is not a kid that I ought to be dealing with, it's a kid that needs behavioral health services, that there was somebody that could step in and there was someone that they could contact.
Our jail is the largest pre-adjudication facility in the upper Midwest. And when I say pre-adjudication, means we hold them until they are adjudicated by the courts. Many detention facilities or jails run by the sheriff's offices across the country hold both pre and post adjudication. We only hold them until they go to see the judge, and the judge determines a finding in terms of what they're there before the court for. If guilty, they'll go out to maybe one of the county's workhouses and or state prison system, or back out into the community on probation. We guesstimate conservatively, just in my facility, that about 1/3 of those inmates suffer from mental illness. 3.9 beds available for every 100,000 residents. It's not enough. And I'd venture to say all across this country, the other sheriffs like me, about 3,100 of us, all face the same things. Now, once our court orders treatment for these inmates, we now have a statutory mandate for our state's Department of Health and Human Services that they must provide a bed and transfer within 48 hours.
I'm going to be talking about implementing evidence-based programs, which are clinical programs designed to help youth with behavioral and emotional disorders who are involved in the juvenile justice system, as Joe referred to. And I'm going to do it in the context of a case study of what's been going on in Washington State, give you an idea of how it's worked there, our successes and lessons learned. So amongst other things, what this act did is it created an advisory committee, which is called the CJA Committee, which is the Community Justice and Accountability Act Committee. And they were in charge of selecting the community-based programs that would be eligible for state funding. And one of the requirements is that these programs had to have some evidence, some research evidence behind them that they would reduce delinquency. The good news is that when these programs are implemented as they are intended to be implemented, with fidelity or adherence or some of the words that we use, and the therapists that are doing the work are competent, you see big reductions in juvenile recidivism, and these kids don't commit more crimes. The concerning thing is that if kids get these programs and their therapists are not competent, their outcomes are even worse than if you had not done anything. So our policymakers are faced with kind of this interesting conundrum, which is if you do it poorly, you can actually make things worse. So it's really, really important to do it well, because then you'll make it much, much better. As a consequence of finding this out, Washington State has now invested in quality assurance infrastructure. So there are now quality assurance specialists that work with all of the therapists and group facilitators that are implementing these EBPs to ensure that services are being implemented in a competent way.